Physiotherapists, and welcome back to another video. In this video, we will be discussing the role of chest x-rays for physiotherapists in the ICU, but also other considerations that we need to be aware of when working in this area. As you can see from the previous video, chest x-rays are valuable to a physiotherapist when designing physiotherapy management for a patient in ICU. Chest x-rays allow us to view contraindications that patients may have to treatment plans and enable us to monitor this. However, while chest x-rays can be helpful in guiding this kind of physiotherapy management, there are other factors that we need to be aware of when designing treatment plans rather than relying on CXR alone. As physiotherapists in the ICU, we need to understand medical assessments and treatments which will allow us to have a clearer understanding of the things the patient can and cannot do. Medical assessment, including OBS and vitals, white blood cell count, hemoglobin, and electrolytes such as sodium and potassium are important because, for instance, if someone has low hemoglobin, it is hard for them to have enough oxygen to be able to mobilize. Obviously, this affects our physiotherapy management. If we have an understanding of when a patient's potassium and sodium is out of normal range, then we understand if the patient has heart issues, which could mean that they might go into defibrillation during treatment. Other important factors that help determine treatment plans for patients include symptoms such as chest pain, fatigue, shortness of breath, fever, breath odor, problems swallowing, and coughing up foul-smelling green sputum. For example, if a patient fatigues quickly, we need to be mindful of this when asking them to move around and mobilize in the ward. Physiotherapy-specific assessments, such as auscultation, also allow us to understand exactly what is going on in the lung when managing that patient. Other tests that can be used alongside chest x-rays to help diagnose cardiac, respiratory, or pulmonary conditions, such as aspiration pneumonia, include sputum samples and blood tests. I hope you enjoyed listening to this video presentation, and I look forward to seeing you in the future working together.